Hi everyone, I am Estrella, the co-founder of Bwom, and we are changing self-care for women. Women experience many transitions and changes in their bodies during a lifetime, and healthcare systems as of today don't have the necessary tools and resources to offer them preventive personalized solutions. So what happens is that a lot of these changes and early symptoms end up turning into more serious health problems because they go unaddressed. Just to give you one example, out of our more than 200,000 users, 60% of them are currently experiencing mild to severe urinary incontinence, and only 2% of them have been referred to the right specialist and offer a long-term solution. This is just one example, but all of these silent, invisible issues have not only a social impact on the women experiencing them and their families, but also an economic one on multiple stakeholders, from insurers to employers. So imagine if we could turn all of these preventable costs into a thriving business that makes people's lives better. Bwom is a digital tool for women's wellness and self-care. Our programs offer women first a test, then an evaluation, and then provide them with a personalized care plan that includes guided exercises, recommendations to achieve their goals, daily habits, educational content, a tracking tool for them to see their evolution, and suggested products. Our programs are based on two main pillars. First of all, we have a holistic approach to health in looking to lifestyle factors and a lot of related issues that might be connected to one another. And secondly, we don't just provide content. We actually invite them to take action and change certain habits that are going to help them get to better health outcomes. First of all, we needed to focus on expanding B2C. For the first 2 years, we were testing different monetization models and ended up launching a freemium subscription model that we've gotten a 3% conversion to paid with. But this was a very important phase because we really needed to learn how our user wanted to interact with the tool and what their main concerns were. And this defined the rest of the development for the past 2 years. Additionally, we've been building partnerships and relationships with leading innovative companies that have complementary products that we offer through a marketplace under a commission type of agreement. But now, after 2 years and growing to more than 200,000 users in 10 countries and gathering 3.5 million health data points, which gives us a pretty good picture of the state of women's health in different areas, we're ready to launch what will be actually our main source of income for the business. Our B2B2C model aims at supporting healthcare stakeholders in helping and managing their female populations better. We have identified 4 main groups that we can provide value to in different ways, but have decided to start by focusing on the employer group. We want to help them with increasing retention and engagement, particularly after the maternity transition, which is life-changing, and also want to guide them in making better wellness and prevention program investments and in reducing costs through prevention and early detection programs. To make all of this possible, we have a senior team of professionals with entrepreneurial experience and a health advisor who oversees all the contents and coordinates the different specialists that we work with to create everything that's delivered through the app. And we raised a seed round last year with international investors led by Hansi Hansman, who is also the lead investor of, for instance, My Sugar, that was just recently acquired by Roche. So what's next for us? 2018 is going to be the beginning of our main expansion phase. We now know our users and we understand the market and are ready to raise a Series A, which will allow us to finally build a business development team so we can scale that side of the business, while at the same time strengthening our development team to keep our tool up to date to the latest technology and contents that is out there. And finally, we really want to start partnering up with healthcare organizations so we can develop research with all the data that we have. So collectively, we can really bring to the awareness of the people how important it is to take seriously women's health and address it as a collective. We're Bwom and we're changing self-care for women. Thank you.
Thank you. My question is this is an application. Are there other apps out there that do similar things? And what's the barrier to entry for you? Or what's their value proposition versus those?
Yes. So there are other apps that do parts or related contents. There's a lot of fertility apps, pregnancy monitoring apps, and parenting. But what we've done, and the way I usually explain this, is we have completely moved away from period tracking or fertility, other than to integrate it as part of the treatments, because what we deal with is all the symptoms that the woman is going to start experiencing as a result of. So we focus on a lot of pelvic floor issues, core-related issues, intimate health, not specifically those areas. So we don't have any direct competitors right now, but definitely there are some apps that are doing a great job in other women's health areas that could potentially aspire to, at some point, expand to this area. It's a lot of work. The content that is there takes some time. Yeah.
Behavior change, as you know, is incredibly difficult, and now you're moving from B2C test to B2B2C through the employer group. How are you going to initiate behavior change working through the employers to get to the employees?
That is a very good question. Actually, we're looking to close our first pilots, and hopefully we'll launch a couple in Q1. The first thing we need to analyze is draw some KPIs. This phase is very important for us because we're still in a moment where we can co-create and co-develop with the experiences that we get from the first pilot. We're looking to analyze what the support that we get from each employer is, what type of organizations are going to be better, are encouraging their users, and how to better incentivize them. The experience that we have so far from our users that we've acquired directly is that, particularly for the first 4 weeks, they stay quite engaged because they start seeing results after 2 weeks. So there are certain behavior changes that we have been noticing, and even though we know that there's a challenge to extend that over time, that's exactly what we're analyzing now with the first pilots.
My question was, how are you going to maintain usage over time? Typically, people drop off using an app fairly quickly, and they go back to previous behavior.
Well, first of all, in the direct-to-consumer part, already with the users that are active for a month, we have a revenue model that we have more revenues than what we spend acquiring them over time. So with only 1 month of usage, we will be already monetizing that. But the thing with the type of issue that we deal with is that some of them become chronic and some of them are recurrent. If you have a sort of problems when you have your first baby, you're going to have to experience some others when you have your second and your third. And because over time, these are issues that need even more and more attention, there's going to be a recurrency and a go back to the product every time there's something else that comes up. That's why we have such a wide scope.